Hello and welcome to Physio Classroom. This is our fourth lecture on Mckenzie therapy. तो लास्ट के 3 lectures में we have discussed about the basic concepts of Mckenzie therapy. We have also discussed about the QTF classification for neck and back pain, and in the previous video we discussed about the history taking skills for neck and back patients. This is our fourth video, and in this video we are going to discuss about the Mckenzie assessment for neck pain patient. Mckenzie assessment for neck pain patient is done in 5 simple steps. The first step is examination of the sitting posture. The second step is examination of the standing posture. The third step is the examination of the neck movements, which is followed by the fourth step, which is dynamic mechanical evaluation of the cervical spine. And finally, the fifth step, which is the static mechanical evaluation of the cervical spine. Now, to keep things straight and easy, I have divided the Mckenzie evaluation for cervical spine into 3 separate videos. In this video, we are going to discuss the first 3 steps of cervical spine examination. So let's get started. Mckenzie examination for neck pain patients starts with the examination of patient's posture. The patient should be made to sit on an upright or straight back chair while the history is being taken. It is during this time that the true nature of sitting posture is revealed. The patient usually assumes their habitual sitting posture after few minutes of sitting. After the patient's interview is over, the therapist asks the patient to sit on the edge of the examination table with his back unsupported. The therapist now examines the patient for the 3 important features, which are: number 1, does the patient hold the head upright or is the head protruded in a forward position? Number 2, is the head and neck held in a flexed position? The therapist also examines for the exaggerated kyphosis at the cervicothoracic junction, that is, the presence of Dodger's hump. The third important feature that the therapist should look for during the sitting posture evaluation is the presence of torticollis, which is the cervical lateral flexion and rotation in the opposite direction. After recording the findings of the sitting posture evaluation, the therapist should now proceed towards the examination of the standing posture. The patient is now asked by the therapist to stand and be still for 3 to 4 minutes. Initially, no evidence of forward neck posture might be seen, but after some time, as the patient relaxes, the head and neck assumes a more forward position, which should be recorded by the therapist. So now we have completed the first 2 important steps of Mckenzie evaluation of cervical spine. And now we have a fair idea about the patient's sitting and standing posture. The third step in the Mckenzie evaluation for neck pain patient is examining the range of motion of the cervical spine. Evaluation of the cervical spine range of motion should start by making the patient to sit in an upright posture. ध्यान रखें, अगर आप अपने पेशेंट को अपराइट पोस्चर में नहीं बिठाते हैं और उसकी सर्वाइकल स्पाइन की रेंज लेनी शुरू कर देते हैं तो आपको फॉल्स रिजल्ट्स मिलेंगे। ऐसा इसलिए होता है कि जब सर्वाइकल स्पाइन प्रोट्रूजन या फॉरवर्ड फ्लेक्शन में चली जाती है तो सर्वाइकल स्पाइन के लोअर वर्टिब्रेज एंटीरियरली ट्रांसलेट कर जाते हैं, जिसकी वजह से सर्वाइकल स्पाइन के लिगामेंट्स और कैप्सूल्स टॉट हो जाते हैं और वो सर्वाइकल स्पाइन को अदर रेंजेस या अदर प्लेन में चलने से रोकते हैं। तो आप जब पेशेंट को इवैल्यूएट करें तो इंश्योर करें कि आपका पेशेंट न्यूट्रल अपराइट पोजीशन में हो और उसके बाद आप सारे सर्वाइकल स्पाइन के टेस्ट को स्टार्ट करें। सर्वाइकल स्पाइन मूवमेंट इवैल्यूएशन के टाइम पर थेरेपिस्ट को दो इंपॉर्टेंट चीज़ों को नोट करना है। वन इज द रेंज ऑफ मोशन एंड द सेकेंड इज द क्वालिटी ऑफ मोशन। क्वालिटी ऑफ मोशन के अंदर थेरेपिस्ट को नोट ये करना है कि जब भी वो किसी भी मूवमेंट को टेस्ट करता है तो वो मूवमेंट अपने रेस्पेक्टिव प्लेन में हो रहा है या मूवमेंट प्लेन से डेविएटेड है। फॉर एग्जाम्पल, अगर आप फ्लेक्शन मूवमेंट को टेस्ट करते हैं तो इसको आइडियली सजाइटल प्लेन में होना चाहिए, लेकिन अगर आपका पेशेंट स्लाइट लैटरल टिल्टिंग के साथ में फ्लेक्शन कर रहा है तो आपको इसको भी नोट करना है। रेंज ऑफ मोशन इवैल्यूएशन ऑफ सर्वाइकल स्पाइन को आप इस तरह से कैटेगराइज करें: नॉर्मल और फुल रेंज, रेंज माइल्डली अफेक्टेड, moderately affected and severely affected. So to summarize, before you start taking the range of motion evaluation in the cervical spine, make your patient sit in an upright posture and not only record the range of motion but also the quality of motion. So let's begin. The first motion to be examined is cervical spine flexion. After the patient is made to sit in the neutral upright sitting posture, the therapist first demonstrates the movement and then instructs the patient to bend the head as far forward as possible so that the chin rests on the sternum. The patient should then return to the neutral upright position and the range of motion is recorded by the therapist. The next motion to be assessed is cervical spine extension. The therapist first demonstrates the motion and then asks the patient to bend the head as far backwards as possible and look upwards towards the ceiling. The patient should then return to the neutral upright position and the range of motion is recorded by the therapist. The next motion to be assessed is cervical spine rotation. After the therapist demonstrates the motion, the patient is asked to turn the head as far to the right as possible. The patient should then return to the midline. The same sequence is then repeated on the left side. The range of motion present in both the sides is recorded. The next motion to be assessed in the cervical spine is lateral flexion. After the therapist has demonstrated the motion, the patient is instructed to laterally flex the head to the right as far as possible. The patient should then return to the upright position. The same sequence is then repeated on the left side. The range of motion present in both the directions is recorded by the therapist. So now we have completed the first three steps of Mckenzie evaluation for neck pain patients. अब तक के किए हुए टेस्ट से हमें एक फेयर आइडिया लग चुका है कि पेशेंट के प्रेजेंट कंडीशन में उसके पुअर सिटिंग पोस्चर, पुअर स्टैंडिंग पोस्चर का कितना रोल है। साथ ही साथ प्रेजेंट कंडीशन की वजह से पेशेंट की नेक की रेंज ऑफ मोशन कितनी अफेक्ट हुई है। रेस्ट्रिक्टेड रेंज ऑफ मोशन से हम ये कंक्लूड कर पाते हैं कि पेशेंट डिरेंजमेंट या डिसफंक्शनल कैटेगरी का हो सकता है। नेक्स्ट वीडियो में हम बात करेंगे अबाउट द फोर्थ स्टेप ऑफ मैकेंजी इवैल्यूएशन फॉर नेक पेन पेशेंट्स। इसके अंदर हम प्रैक्टिकली डेमोन्स्ट्रेट करेंगे 6 इंपॉर्टेंट टेस्ट्स जिसके द्वारा हम कंक्लूड करते हैं कि हाउ इज द पेशेंट्स पेन रिस्पॉन्डिंग टू सर्वाइकल movements. So keep learning, keep sharing and stay connected.